I'm going to talk to you how to find your directional preference with low back pain if you have one. As a reminder, with low back pain, usually it's just that with low back or leg pain. It's pain, it's usually not harm. The three things you want to look for is no obvious sudden weakness in your legs or elsewhere in your body, no loss of bowel and bladder function with going to the restroom, and no numbness where you'd sit on a bike seat or wipe when you're going to the restroom. If those things are going on, then contact your provider right away. Also, if you've had a history of like a lumbar fusion or something, you might want to check in with your PT or physician before trying this stuff. So I'm going to talk to you about an extension bias with low back pain. So the usual causes of this, it could be a disc bulge or herniation. It can also just be that your ligaments and low back muscles just like don't love flexing. Okay, so with this presentation, when you have an extension bias, this is that when you bend down to touch your toes or are sitting or kind of try to pull your leg up, any of those flexion things where your thighs are getting closer to your chest, that it hurts you and reproduces your symptoms. The goal would be with a directional preference is if bending back or walking or standing feels better. If those things feel better to you and you have either it feels good for your back or works your leg pain kind of back up towards your back, even if you have a little more back pain but it helps the leg pain, then you are an extension bias individual. If you need help figuring this out, go see your PT and they will help give you the directional preference if you have one. About 40% of people have a true directional preference, says the literature, and then in my experience another 20% kind of have one, and then the other ones you kind of just got to stick with moving with what feels good and not doing what feels as bad, and try to stick at least with our motor control series stuff where you can try manipulation to get things down. So with the extension bias, this is you'll find with a pelvic tilt. So the easiest thing is first checking that flexion and back bend, and the back bend would usually feel good. Then the next best thing is really being able to control with your pelvis. And so with that, I like to think of if I was wearing a belt buckle. If I take this belt buckle and I pull it up towards my nose, which will flatten my back into the ground and round it, that would hurt probably if I had a flexion sensitivity and an extension bias. Then if I go and I point my belt buckle down towards my toes and arch my back, that would feel pretty good. Or at least better or not as bad. And so what I would do with my extension is I would just start by, I will bring the belt buckle up towards the nose and do what we call a posterior pelvic tilt right up to my pain, but not through my pain. And then I'll go ahead and arch. And then while you're doing this, not only are you doing it to help with your pain, you are doing it to then apply with all your movement patterns. The more that you can then hold an arch, and the goal would be a relaxed arch, not like 100% every time. If you do 100% every time, you can overuse your back muscles and create a strain, and then the extension isn't as helpful. So just as much as you need to feel good, ultimately try to be as close to neutral spine as you can, but use that as a strategy, okay? So that's huge. Then when you do movements like turn over in bed or bring your legs up, you actually want to put a little arch. And with that, your ab muscles actually don't do that. Your back muscles do that. So you're not going to do the whole like bracing, holding your breath thing as much as just arching and then kind of keeping that arch as you move. And so the goal would be with our kind of neutral spine stuff that you'd be able to do a march. So the goal with a march is you hold a little bit of a tilt, and then normally as your thigh comes to your chest, it would make your back flatten. And so you're not letting it flatten and you're keeping it arched. And then the things like putting on your shoes and socks and stuff, if you can replicate this in that position, that will help you. And same thing if you're doing like a figure 4 stretch, you keep a little bit of an arch. And if you're doing a hamstring stretch, you're keeping a little bit of an arch. And by stretching the back of your hips, that will allow you to bend forward more from your hips and less have to flex through your back. So those strategies will be helpful when you're extension biased. So I kind of do those pelvic tilts, and I do those like as much as feels good during the day. And then I apply it to my other positions. So then you're going to go hands and knees, okay? And with your hands and knees, you're going to, again, kind of belt buckle towards toes, arch as much as feels good. Belt buckle up towards nose, and then you would probably get a pain somewhere in there. So again, to it, but not through it. And then arch, and then flex. And then the whole goal with an extension bias is we use it to manage our symptoms, but as that gets better, then we work into our flexion progression and try to restore our flexion. And the whole goal is acceptable level of pain, not worse the next day, as active as possible. So I'm really focusing on the arching of this one, okay? Then I would go into standing, and when I'm standing, typically what would feel better is to arch a little bit. Not necessarily end range, although that might be best, but just a little bit of an arch, and that will help as I'm moving around and whatnot. If I kind of do that tuck under ab brace, that actually might hurt me. So with function, I want to do that. So then the kicker is then sitting. So sitting tends to hurt, okay? So what we want to try to do with sitting is, one, the higher the surface, the better. So I'm going to kind of show you actually sideways here. If I actually can sit, if I have to sit, I'd rather stand if I could in this, if I'm extension biased. But if I have to sit, turn it this way. I would rather have a higher seat, almost like a bar stool, but I want to be able to put my feet on the ground. And if I sit here, I just naturally am not slouching by the way that it kind of tilts my pelvis forward. And then if that still hurted, I could just kind of tuck belt buckle down, give myself a little bit of a back arch, okay? The reality is that might get tired for a time, so a little bit of a slouch, as long as it doesn't hurt, is okay. So a little bit of that arch, okay? Then if you are forced to sit in a lower seat, like a car seat or something like that, what you can do, I've got this fancy kind of pool noodle, okay? But what you can do is also just like roll up a towel, or you could get a nice fancy lumbar support. I like having something mobile because I can change. So I actually prefer, rather than going lumbar support, so one, I would get the chair as high as I could if I could, but if I couldn't, and you actually put it kind of under the back side of your tush, and then that naturally just props me forward. Like I'm not working at all to hold this tilt, okay? Eventually though, I might get a little fatigued there, and the more that I can break up my sitting with standing and walking, the better. And then same thing here, I could actually add a little bit of an extra pelvic tilt. So, but then if I must, I can put it back as kind of like a lumbar support as well. And then I could go back and kind of rest in the chair, and I can move it up or down depending on what felt best. And again, over time with sitting, my back might not love this. So the other thing too is that usually if you're sitting and you kind of straighten this and move that, when you're flexion biased, that really like lights you up. So so try to limit kind of the straightening of the knee in those sitting positions, and then a PT can help guide you into some flossing and stuff that would actually be helpful to work back into that. Okay, so so that all looks good. So that's kind of the sitting stuff, and you try to apply that in your car as well. And then yeah, with other forward bend stuff, the goal would be, instead of going here, that I actually do a hip hinge. So you can check out our hip hinge video and kind of follow along with that. So I'm just staying neutral. I'm not necessarily even trying to arch my back. And if that is a little painful, you can try to arch your back a little bit more as you do that. But that way I can actually bend things and kind of pick things up, okay? Then we would go with our extension progression, and you can go ahead and kind of check that out. So if you go through the rest of this playlist now, our extension bias playlist for low back pain, we take you through kind of those initial steps. This is kind of the initial starting point and overall education. With this, the more that you can go on walks throughout the day, the better, and you should really notice a marked improvement. So remember that as long as you don't have those other three issues going down, as far as sudden leg weakness, bowel and bladder issues, numbness where you'd sit on a bike seat, usually your back pain is hurt, but not necessarily harm, even though it might hurt a lot. And so as active as you can, and if you're in that extension bias, then you can try these things and then work through our playlist of our progression. Then always work back to as things improve with the flexion, go through and you should be able to clear yourself through the whole flexion progression. And then all along, definitely be working on our motor control and our strength stuff as well. So when in doubt with extension, a little bit of that belt buckle down, a little bit of a low back arch, and that can be a huge help for you. The dosage is really as often in the day as feels helpful, and you should track that the bending forward and the sitting and all of that should be getting better as you progress. If you do get a flare-up, you should try any of these strategies, and the ones that help you calm your symptoms back down, the better. So that's our extension bias kind of initial protocol, and then definitely kind of run through the progression to get stronger and get back to the things you need to do without low back pain. Hope that's helpful, and we'll see you around.